Well, to Africa, this is nothing new. So we reached out to Dr. Tashrik Ahmed. He's one of the leading epidemiologists on the team. We asked him how this program benefited from what African countries have learned about containing infectious diseases.
From HIV and STDs, which have been running disease or contact tracing programs for decades now and leveraging on that experience. But then also one of the key members on staff was Tolbert Nyanswa, who is the Director General of the Public Health Institute in Liberia and headed the incident management system during the Ebola outbreak. I myself was also the country director for Johns Hopkins in Liberia for 2.5 years, and much of my experience with contact tracing is also from the Ebola context. I would say that the perspective of what was able to be done in Africa to strengthen health systems' ability to detect disease through contact tracing was very well leveraged into the coursework.
Now, Dr. Ahmed says contact tracers need special skills and traits to be successful.
The emotional intelligence is one of the most important traits for contact tracers. It's a presence of mind on the call. So it's attentive listening, how to be assertive rather than aggressive, how to respond and make sure that the person that you're talking to feels heard. So there's a difference between saying, I completely understand what you're going through, and saying, I hear you, I understand you, I see what you're going through. So the benefit of the interview-based process is that if someone says that they don't remember going out at all last week, you can then double check that. So we teach the contact tracers in the course, how do you ask prompting questions? Where did you eat? Where did you go? How did you get there? And between that back and forth, we help them remember and increase the ability for us to detect those exposures. I think this is another area where the examples from West Africa are very valuable, because one of the biggest techniques that they used there were to make sure that the contact tracers were representative of the communities in which they were contact tracing. So again, it wasn't that these were high-level government officials and public health officials who were going into communities. They were taking from those communities the community health workers who understood the context. So there's a difference if someone is Muslim, having a Muslim contact tracer, knowing to prompt them around Ramadan and Iftar, versus someone from a tribal community knowing what the rituals are that they need to ask about. That also helps build rapport in a way that doesn't need to. It's not so mechanical.
While Ebola and COVID-19 are both deadly viral diseases, Dr. Ahmed says there are important differences between the two.
Our best estimates is that Ebola is 10 to 50 times more deadly than COVID-19, but then spreads at a much lower rate and is a lot slower to spread throughout a community than COVID-19 can be. This prevents different challenges. Both of them had an unprecedented scale within their context. We're seeing hundreds of millions of COVID-19 cases, but then Ebola was also an unprecedented scale in West Africa, and both of those require different considerations from the health systems to be able to sustain those types of programs. I think one of the biggest differences with COVID-19 is that people who are positive and symptomatic may not know it. There are many people who are positive that are unaware that they might be positive. Their symptoms are relatively mild. And so when they're contacted for contact tracing, they might not understand the severity of the risk that they present to the more vulnerable parts of society. So that communication to the public around the importance of compliance with contact tracing and keeping the community safe is definitely harder without that, the day-to-day impacts that they might not see because they're not feeling as sick as you would with Ebola.